Dr. Warden, I was going to ask you straight out.
Yes.
How many breast implants have you done in your career?
Thousands. Just think of all the happy people I have out there running around. And happy husbands, too.
Well, we heard about a new product that some are saying is the future of breast implants. They're called the Ideal Implant. It was FDA approved this year. Dr. Warden, thoughts?
You know, called Ideal because it is supposed to be the best of both worlds. A saline implant, which we know is safer because it's just sterile salt water, but more of the feel of silicone. And I was involved in the trials, the testing. So this is what we're talking about. We have the original type saline, and you can see here that it's more like a water balloon. It jiggles like a water balloon. It's more likely to form ripples when it's in the body versus silicone, which has more a jelly or jello-like fill. And then we have the Ideal Implant, which is a hybrid. It is filled with saline, but because it has chambers, a baffling effect, it's going to give you more of a silicone feel being saline. It's
great.
It's a reasonable.
I'm just gonna test it out.
You know, and for.
Hold on.
You can't.
Hold on.
Just like they say with potato chips, you can't have just one. You need two.
I'm gonna put it over my bra.
Doctor, do you need some help there?
Take a feel.
You know, obviously you look much bigger with these implants when you put them
Well,
on
it's
top of
over
your
my bra.
Exactly.
Over my padded bra, if you must know.
You would be quite the sweater girl in that, let me tell you.
No, but you know, this is, I like that there are more options for women.
There are options.
I had asked you before when we were talking about the show, what's the percentage quoted for leak or rupture of, let's say, a silicone implant?
The new design of silicone implant is much better. The outer shell is much stronger. The filling is what we call a cohesive filler, so it's not runny. If there was to be a rupture, it doesn't spread. You know, the old days, the filling was less cohesive, and you know, this is a problem. If this ruptures in the body and this silicone gets out, is not good. And you know, anybody that has a history of connective tissue diseases is not a candidate for silicone.
Okay,
so,
but 1%, 2%, 3%, how many times, what's the incidence of silicone rupture today with the new implants?
Very small,
single digits.
Single digit.
Okay.
So let's show really quickly some before and afters of a woman that did have these breast implants.
I mean, that looks great.
It does. Natural, no rippling.
And I will say, Drew, you know, you and I have talked about this before, because obviously I'm doing breast exams on every single patient I see. You absolutely can tell the difference between silicone and saline. And in 11 years of all of my patients who have had implants, I only have one patient who's had a rupture, and it happens to be with their old implants. They're about over 20 years old, but she does have a rupture.
All right, let's show that picture again. Meredith, are those pictures of you or no?
Those are me.
They are?
It's kind of freaky to see my boobs on TV right now.
No, I actually didn't know that. I knew we had before and afters, but what do you think? I mean, at the end of the day, Meredith had this done. What matters is, are you happy?
I am so happy. After having 2 kids and nursing them each for over a year, I had mosquito bites. So I wanted to go back to my pre-baby shape, and my mother-in-law, of all people, told me about the Ideal Implant, and it seemed like the perfect solution because I wanted saline, you know, just being cautious, being a mom. And I had them 6 years ago, and they're phenomenal.
Well, that's all that matters.
Something you see of all the time, the mommy makeover, ideal candidates for breast augmentation after pregnancy, breastfeeding, you've lost volume, you want a little.
Or just age.
Meredith, we are happy that you're happy. Thank you for sharing more.